Hello everyone, my name's Hermann Fasching and I'm going to speak about the safety performance for the mineral mine and quarry sector, what those numbers mean and highlight why we will continue to focus on particular ones. I'll share with you the regulator's observations on industry's performance in managing safety and health risks to workers, both from the context of compliance with legislation and progress on implementing or applying the recommendations from the Brady Review. I'll provide a brief update on RSHQ's progress on implementing the recommendations of the Brady Review, and I'll remind you about the amendments to the regulations relating to worker health assessments. And finally, I will share with you the focus areas for the regulator over the next year. It has been 2 years since the Brady Review was tabled in Parliament on the 6th of February 2020. Tragically, since then, there have been another 4 fatalities. The Brady Review looked at a 20-year period of data and asked, why are people dying in our industry? It made 11 recommendations on how industry could improve and the Inspectorate can work better. While I won't go into this report in detail, I will be referring to it and the recommendations it made throughout this presentation. In particular, my observations around industry's performance in managing risk. Before I discuss the industry's safety and health performance, I want to speak briefly about what the Brady Report had to say about safety performance measures and their effectiveness. Firstly, that industry should shift its focus from lost time injuries and the lost time injury frequency rate as an indicator of safety because they can be manipulated and are a measure of how industry manages injuries, not safety. Also, many fatality causal factors didn't cause injuries before the fatality. This means no LTI would have been recorded and those causal factors would remain undetected. Importantly, the regulator no longer uses the lost time injury frequency rate as a measure of safety performance or publishes information about them. The serious accident frequency rate should be adopted as a measure of safety in the industry. The serious accident frequency rate is a genuine reflection of how many people are getting seriously injured and require admission to hospital for treatment. It is not easily manipulated as a doctor makes the decision to admit people to hospital for treatment. The report also said that the high potential incident frequency rate should be adopted as a measure of reporting culture. A high potential incident reporting should be encouraged to ensure early warning signals of impending incidents and fatalities are detected. It also provides an opportunity to identify hazards before they cause harm and ensure they are effectively controlled. Let's look at the numbers. Consistent with the recommendations of the Brady Review, the Mines Inspectorate considers the serious accident frequency rate as a measure of safety in the industry. A serious accident is an accident that causes a fatality or results in a person being admitted to hospital for treatment as an inpatient. The serious accident frequency rate has increased across all 3 mineral mine and quarry sectors over the first 2 quarters of this year, when compared to the 2021 year, with the quarry sector experiencing the greatest increase. In the 2021 year, 18 people were admitted to hospital for treatment because of injuries they sustained working in the mineral mine and quarry sector. And for the first 2 quarters of this year, it's 11. The top 3 hazards associated with these serious injuries are falls of people and equipment or ground. Now that's for all 3 sectors, surface, underground and quarries. The second top hazard is entanglement of people, and again, that's across all 3 sectors, surface, underground and quarries. Vehicle collisions come in 3rd place for surface and underground operations, and for quarries it's vehicle rollovers. These hazards are well known and understood within our industry, as are the controls that need to be in place to manage them. This would suggest that the controls are not being effectively implemented or monitored to ensure their ongoing effectiveness. A high potential incident is an event or series of events that causes or has the potential to cause a significant adverse effect on the safety and health of a person. In line with the recommendations of the Brady Review, the Inspectorate considers a high potential incident frequency rate as a measure of industry's reporting culture. Importantly, reporting incidents to the regulator allows for this information to be collated, analysed and shared with industry to improve understanding of how hazards and how associated risks can be managed. At last year's Industry Leaders Briefing, I said that as industry's reporting culture improved, I expected to see the high potential incident frequency rate increase. Looking at the chart, you can see that the high potential incident frequency rate for the underground and surface sectors in the 2021 year remained unchanged when compared to the previous year, and the quarry sector showed a decline. The high potential incident frequency rate in the first 2 quarters of this year has increased across all 3 mineral mine and quarry sectors, underground, surface and quarries, with quarries showing the greatest increase. This is encouraging and hopefully signs of an improving reporting culture. Encouragingly, the Mineral Mines and Quarries Inspectorate is starting to see high potential incidents being reported that may not have been reported in the past. Examples of this include persons found to be working on equipment that has not been isolated correctly, or working at height without having fall protection installed. Unfortunately, all too often, inspectors are still having conversations with senior leaders at sites who argue that a particular incident is not a high potential incident and does not need to be reported. This can be for a myriad of reasons, but the fact that the argument is occurring at all misses an important point raised in the Brady review. Every unreported high potential incident is both a wasted learning opportunity and a hazard left in play that could cause an incident at some point in the future. You must change the way you view any kind of incident that occurs at your site. Your first action after securing the health of your worker and equipment should be to report the incident as a HPI, and your second action should be to investigate and discuss the incident with your team to discover what it teaches you about your processes and your controls. Could it conceivably happen again? What lessons does this teach you? What changes can you make to ensure that it doesn't occur again? Thinking about incidents as a learning experience moves the focus from fear of reprisal to education. I understand that people may be reluctant to report incidents to the regulator because of fear of compliance action, but this thought is flawed when you consider that my inspectors often identify incidents that have occurred on sites that have not been reported internally, yet alone to the regulator. If we are going to identify the issue anyway, why not report it when it occurs? The question remains, what is really driving this reluctance to report and learn? We need to start being proactive in identifying and addressing the barriers to both reporting internally and to the regulator. Examine your reporting systems and investigative approaches. Do they seek to understand or apportion blame? Make greater use of your safety committee members and site safety and health representatives during the investigation and when considering potential controls. Ensure that the lessons from accidents are shared openly with workers. As leaders in the mining industry, how many of you have the courage to promote and support reporting of bad news? Since the release of the Brady Review, the Inspectorate has been undertaking activities specifically aimed at improving the reporting of high potential incidents. This includes identifying and targeting sites with a low or no reporting culture and applying an educational and corrective compliance approach to ensure that sites understand what must be reported and how to do this. One of the focus areas for the Inspectorate over the last year has been looking into how operators are satisfying themselves that the risk to workers at their operations is at an acceptable level. This includes how the operator is ensuring that the safety and health management system developed by the site senior executive is implemented and effective. In addition to the recommendations about the lost time injury frequency rate and the serious accident frequency rate, the Brady Review also made recommendations that industry should adopt a high reliability organisation principles and develop systems that encourage reporting of bad news and look for weak signals that indicate potential control failures that could lead to serious accidents and fatalities. What organisations choose as performance measures matters, as these drive culture, behaviours, business plans, operational objectives, individual performance plans, remuneration, and ultimately impact on how risk is managed. So with this in mind, I reviewed some recent annual reports at random from across our industry sectors and looked at them to see what organisations were reporting and considered key safety indicators. What did I find? Each of the reports contained a section on safety and health. Some of the reports included a focus on lead indicators such as completed investigations, critical risk controls, workforce and supervisor training, effective supervision, proactive hazard reporting. All of the reports had a key measure that looked for a percentage reduction in the total reported incidents, such as the total reportable incident frequency rate and the all incident frequency rate. Half of the reports reported the lost time injury frequency rate and had a reduction of this as a KPI. And one report noted that the executive remuneration was linked to safety performance. While there are encouraging signs that some organisations are starting to utilise proactive lead safety performance indicators and monitoring controls for effectiveness, unfortunately, all still openly state that a key performance indicator is the reduction of reported incidents, and many continue to use the lost time injury frequency rate as a measure of safety. I ask senior leaders in our industry to consider, what do these measures really tell you about the state of safety at your operations? How do these measures help you to satisfy yourself that the risk to workers at your operations is at an acceptable level? Do they support and encourage the reporting of bad news? And do they assist you in looking for weak signals? In a nutshell, how welcoming of bad news would supervisors and managers be at your mines, knowing that meeting current health and safety improvement performance targets and sometimes remuneration is reliant on less reporting? The Brady Review made 4 recommendations for the Inspectorate. The first 2 were to adopt the serious accident frequency rate as a measure of safety in the industry and the high potential incident frequency rate as a measure of reporting culture in the industry. As I said earlier, both these have been adopted and are now used as industry performance measures. The other 2 recommendations, which were in summary, to develop a simplified incident reporting system that encourages and supports incident reporting, and to assist industry to operate like HROs by collating, analysing, identifying and disseminating the lessons learned from the incident and fatality data with industry. In response, Resources Safety and Health in Queensland has commenced a transformational program with a focused, developing an integrated enterprise approach to implementing these recommendations. To support simplified incident reporting, Resources Safety and Health Queensland is developing a contemporary operating platform utilising MS Dynamics to capture, manage and share data that includes end-to-end workflow, a simplified industry self-service portal, centralised incident reporting and triage capability, improved incident reporting methodology with a focus on corrective actions and controls, and to support the collating, analysing, identifying and disseminating of the lessons learned from incident and fatality data, with Resources Safety and Health in Queensland has established a central assessment and performance unit known as CAPU, and that has 3 key functions: to receive, triage and manage incidents that are reported by industry, undertake data analytics for things such as business intelligence dashboards, detecting key trends and correlation controls, risk factors and incident causes. Provision of reporting outputs for industry reports, inspectorate reports, trend reports and ministerial reports. CAPU has commenced the work of data analytics and providing reporting outputs. This information is being used by the Inspectorate to inform its risk-based regulatory approach, as well as providing reports and information to industry. Amendments to the Mining Quarrying Safety and Health Regulation 2017 that introduced the requirement for SSEs to ensure respiratory health surveillance is conducted when workers join the industry, and then at least once every 5 years, takes effect on the 1st of September this year. The respiratory health surveillance must be conducted by an appropriate doctor that includes a chest x-ray, dual read by qualified radiologists to the international standard, spirometry with comparisons where available, and any other examination deemed necessary by the doctor. Importantly, site senior executives must have established systems and arrangements to ensure workers have undergone the medical examination that meets the new requirement by September this year. To assist with the introduction of the new requirements, a range of information and supporting material is available on the Resources Safety and Health Queensland website. This includes template medical examination forms, a register of RSHQ approved doctors and medical practices, a range of pocketbook guides and short videos. For more information around the respiratory health surveillance and mine worker health, please take the time to listen to the presentation from the Occupational Health Unit, which is also part of this year's Resources Safety and Health in Queensland Industry Leaders Briefing. Over the coming year, the Mineral Mines and Quarries Inspectorate will continue to maintain the focus on improving industry's high potential incident reporting and identifying the barriers to reporting. To support this, an inspector has been appointed who over the next 12 months will focus solely on this initiative, ensuring sites undertake thorough investigations and implement effective controls to eliminate and manage the incident causal factors for accidents that cause serious accidents. We'll continue to publish quarterly reports and other information aimed at sharing key lessons and learnings about serious accidents. More broadly, the Inspectorate will continue to ensure that sites are appropriately investigating high potential incidents and that identified controls are implemented and effective. That's the end of my presentation. Thank you. If you've got any inquiries, you can contact us on the email that you can see on your screen now. Thank you.